before the operation, I will have the patient standing in front of a mirror. I will use a marking pen. I will define the areas that I want to remove fat and how much fat it differs from person to person. And then I will mark the areas which are the plus areas where fat will be injected. So in this process, two things are important. A, to understand the aesthetics of the body. And of course, every person has a different idea and different desire about how the end result wants to be. So during this operation, it's important to use the right techniques and facilitate the removal of the fat. These days we have technology helping the surgeon remove the fat, either by activated cannulas that remove fat faster and safer, or the use of Vaser, which also helps us define the body and create high definition in certain areas. But then also we have very safe transport methods of the fat in order to separate the fat from blood, serum, and other materials we do not want to inject. In the majority of the cases, the BeautiFill will be performed under general anesthesia. There are some exceptions to this rule, especially when the amount of fat to be transferred is minimal. So after a period of initial swelling, which usually lasts approximately 6 weeks, some of the fat that has been injected will be lost. We know that, and we tend to inject a little more than it's necessary in order to achieve good results. Following 6 weeks, most of the patients will maintain the result, and actually the fat cells injected will behave as normal fat cells, which means if they gain weight, they will increase in volume in these areas, or if they lose weight, it will shrink. In my experience, fat injection to the buttocks is a very reliable, long-term operation. Very rarely we need to repeat this operation, usually in cases where the patient wants more volume than originally planned. BBL can be a very safe operation if it's performed with the right guidelines and if it's the right patient, and the complication rate can be very, very low, like the majority of plastic surgery operations. During the recovery period, we will provide for you garments that you need to wear. Usually the first 24 to 48 hours there will be small sipping of fluid from the little openings of liposuction in order for the fluid to come out of the body. This is a fluid I need to use during the operation to better extract the fat out. Of course, there will be some bruising and swelling that usually wears off after 2 weeks. And in most cases, within 6 weeks, people will be completely recovered from this operation and ready to assume all their activities again.